treated later. First, they should be screened regularly screening in pre-periodical examinations. So this is the way the occupation should be started, and workers should have to go through pre-employment and then periodical checkups and screening for the occupational diseases. Once the worker starts working, then there should be the environmental factors which needs to be improved. For example, if a person is exposed to dust particles, so as the time passes and period of exposures prolong, then there is more likely than she should have a chances of developing the diseases due to dust particles. Again, the size of the particle is important, as we have seen in our previous slides, that smallest size of the particle can reach to the alveoles of the lungs and can cause serious damage to the lungs. And then the chemical composition is also important, and this is how the pneumoconiosis progresses. The important dust diseases are silicosis, as we have seen in the chart, that the agents are dust and exposures are occupational hazards or exposures. Silicosis, anthracosis, byssinosis, Bagassosis, asbestosis, and farmer's lungs. So this is farmer's lungs can be through grain dust. Asbestosis is through asbestos while dealing with asbestos particle during their work exposure. Bagassosis is an end product of sugarcane, and it is common among sugarcane industrial workers. Then byssinosis is through cotton dust, anthracosis is from coal dust, and silica is from silica dust, which is involved in construction and shipbreaking industries. So these are the inorganic dust, that is coal dust, silica, asbestos, and iron. Iron exposure causes siderosis, is a disease. Asbestosis is a disease. Silicosis is a disease. Anthracosis is a disease. And these are the exposure which is inorganic dust. Coal dust causes anthracosis. Silica dust causes silicosis. Similarly, asbestos particle or asbestos dust can cause asbestosis, and iron dust particles can cause siderosis. So this is called generally, the term uses pneumoconiosis, and these are various types of pneumoconiosis that is listed here. From previously, we have seen that pneumoconiosis due to inorganic dust. Now, pneumoconiosis due to organic dust, that is Bagassosis, which is through cane fiber. Cotton dust causes byssinosis. Tobacco dust causes Tobaccossosis. Hay or grain dust causes farmer's lung. So now it is clear that pneumoconiosis is a lung disease. It's occupational disorders. There are various types of pneumoconiosis and classified on the basis of organic and inorganic dust. Inorganic dust causes anthracosis, silicosis, asbestosis. Organic dust can cause Bagassosis, byssinosis, and farmer's lungs, which are common, and Tobaccossosis, which is due to tobacco dust. So this is how pneumoconiosis is classified, and it's a lung disorders, occupational disorders, which is due to dust inhalation or dust particle inhalation, which leads to lung fibrosis and in some cases lung carcinoma. Now again, the size of the dust, you can see that it is the 5 to 10 micron remains to upper respiratory tract, and it is inhalable. And if the size decreases, that is 3 to 5 micron, then it reaches to mid respiratory tract. And when the size is more small, that is 1 to 3 micron, it reaches to the alveoli and causes lung damage. Now we take one by one the diseases which is comes under the classification of pneumoconiosis. So silicosis, as you can see in the pictures, the workers are involved in occupation. Although they have taken protective measures, uh, one can have shields, gloves, protective shoes, protective clothing, helmets. Silicosis is caused by inhalation of dust containing free silica or silicon dioxide. And occupations involved are gold mines, mining industries, pottery, construction, and ceramic industry. So workers involved in these occupations can have silicosis. So again, they should be they should have gone through a pre-employment medical examination. Then they should have a periodical checkups, screening. As time passes and exposure becomes prolonged, then they might develop lung disorders or respiratory tract infections due to the silica dust. So there should be a timely screening of the disorders so that prompt treatment can be applied and they can be prevented from occurring these serious kinds of lung disorders. Then comes the incubation period. It can be vary from few months to many years, but as we know that the worker is having a prolonged exposure and time passes, then they become a higher risk of developing these diseases. The factors responsible, again, you have gone through that: the chemical composition, size of the particle, duration of exposure, and individual susceptibility. If individual has not gone through pre-employment examination or the worker is not enrolled for this occupation, then there might be an individual having some risk before entering into the occupation. Then she should be more susceptible, or maybe some kind of allergic disorders or autoimmune disorders, which should be taken into account before taking or giving the job to the workers. Size is 0.5 to 3 micron particles inhaled, particles ingested by phagocytes which accumulate and block lymph channels. This is the pathogenesis of the disease. The dense nodular fibrosis, nodules 3 to 4 mm of diameters, can be detected on investigations. The sign and symptoms is irritant cough, dyspnea on exertion, pain in chest, and total leukocyte count decrease. On X-ray, diagnosis can be made, and typical snowstorm appearance in lung field, especially in upper one-third areas and wards. So this is the X-ray which shows a snowstorm pattern, and this is how the disease can be diagnosed. And this can only be done if a continuous periodical examination of the workers be made, and so the disease can be early detected. Disease can be early detected, and preventive measures can be, or treatment can be applied. The second is anthracosis, which is caused by coal dust. And it is common among coal workers, coal miners. From ancient times, it's a most important occupation, and peoples are involved. There are serious incidents. If you can go and search, mine blastings are very common, and there is serious morbidity and mortality associated with these coal mine workers. So simple pneumoconiosis, there is little ventilatory impairment, and it can be detected through, again, screening of the regular screening of the workers or and their periodical examination. Then if it is untreated or undetected, progressive massive fibrosis occur, which is a serious respiratory disability and frequently results in premature deaths. Once the progressive massive fibrosis occurs, it is irreversible, and unfortunately, the fatality is very high. You can see that how progression among coal miners, once a background of simple pneumoconiosis has been attained in coal worker, progressive massive fibrosis may develop out of it without further exposures. So once the exposure has occurred and damage is caused to the lung, then there will be progressive massive fibrosis and which leads to premature death. Byssinosis is again inhalation of cotton fiber dust, cotton factory or some other factories where this cotton dust is the end product or exposure. Sign and symptoms include chronic cough, progressive dyspnea, chronic bronchitis, emphysema, and chest tightness. Factors responsible are again chemical concentration, exposure time, and coarse cotton is a risk for this byssinosis. Treatment is again symptomatic, and other features include mild fever, malaise, and rigor. And you can see that it is people are sorting wool, and cotton is the exposure for this disease. Bagassosis is the end product of sugarcane, and it is caused by inhalation of bagasse or sugarcane dust. Occupation is sugarcane industry. Signs and symptoms include breathlessness, cough, hemoptysis, fever, bronchitis, impairment of pulmonary functions. If it is treated early, then the problem can be resolved. If it is untreated, then it is responsible for causing diffuse fibrosis of lung, emphysema, and bronchitis. Asbestosis is caused by asbestos. These are the occupation, for example, roof tiling, brake lining, fireproof textiles, asbestos, cement manufacturers. These are the two types of asbestos, that is serpentine and amphibole. Asbestos enters. Dust particles of asbestos enter by inhalation. These fibers are insoluble. The dust deposited in lung and causes again pulmonary fibrosis, leading to respiratory insufficiency and ultimately death. You can see the picture of lung where asbestos is causing damage, fibrosis of the lung. So again, this is an important kind of pneumoconiosis. This shows lungs with asbestos-related diseases. You can see that pleural plaque, and when the exposure is massive, after massive progressive fibers, it leads to mesothelioma, which is a lung cancer, and it's also called cancer of the pleural coverings. You can see plaques on diaphragm and asbestosis causing scarring of the lung tissue. So it's again a serious disorder, and it can be prevented by taking preventive measures. In fact, all kinds of pneumoconiosis are preventable occupational disorders. The prevention can be taken at individual level, at organization level. The environment should be safe, and at family level as well, because the workers carries asbestos particles in their clothes to the families, and then the family members, especially children, can inhale those dust particles which is stick to their clothes. So preventive measures can change the whole scenario, and the occupational diseases can be minimized. So the sign and symptoms of asbestosis are dyspnea, clubbing, cardiac distress, cyanosis, sputum shows asbestos bodies. X-ray chest shows ground glass appearance in lower two-thirds of the lungs. You can see that X-ray is showing a ground glass appearance, which is a typical feature of asbestosis. As you have seen storm pattern in previous chest X-ray, in asbestos you can see ground glass appearance. This is a more clear picture. Now, what is farmer's lungs? It is caused by inhalation of moldy hay or grain dust, because farmers in farms involved with cutting of grains, so they deal with the grain dust, and as this dust is inhaled by farmers and the prolonged exposures, then again it causes lung damage. This is the left lung is a farmer lung, which is affected as compared to the right lung, which is normal. In grain dust or hay with a moisture content of over 30%, bacteria and fungi can grow rapidly, temperature to 40 to 50 degrees centigrade. This heat encourages the growth of thermophilic actinomycetes, of which Polysporophyni is the main cause of farmer's lung. So this is the mechanism of farmer's lung disease, which is due to inhalation of grain dust. Sign and symptoms includes dyspnea, fever, respiratory insufficiency, lung capacity, repeated attack, cause pulmonary fibrosis, inevitable pulmonary damage, and cor pulmonale. Now, we have done with the major types of pneumoconiosis, that is anthracosis due to coal dust, coal miners, silicosis due to silica dust, Bagassosis in sugarcane industry workers, and Byssinosis, cotton dust industry, and then farmer's lungs, which is inhalation of grain dust. So now how can we apply preventive measures, and how can we control pneumoconiosis, which is our today's topic? So medical measures include application of ergonomics. Remember, in last lecture we have deal with the ergonomics. Ergonomics is a science in which, in simple words, the job is fit to the workers. So the whole environment is according to the need of the worker. Either it could be machines or it could be industries or anything. So job is fit for the workers. This is ergonomics. So application of ergonomics, you can provide preventive measures according to the job and need of the workers. Regular medical follow-up, that once when the worker is selected, there should be a pre-employment checkup, and then once it is enrolled in the industry, the worker should have a regular periodical medical follow-up or checkup, so that early screening of the workers for these occupational disorders, they can be early detected so that prompt treatment can be applied. Then health education, that is continuous education of the workers regarding the risk factors, that is exposure or hazards, and preventive measures which can be applied, or make sure that they are adopting all the taking all the precautionary or preventive measures during their job. Notification of the disease. If during the screening or periodical examination, anyone is detected sign and symptoms of pneumoconiosis, then it should be notified as an occupational disease to the concerned authorities. And finally, there should be a continuous research on the prevalence and incidence of pneumoconiosis, the risk factors involved, and there could be a health education trial. So these are the medical measures which can be applied to prevent pneumoconiosis. Then comes the engineering measures, which is more or less related to the environment, that there should be a good ventilation in a factory, isolation of the process, dust control, substitution if possible. If exposure is harmful, then it can be substituted with the other chemical, metal, which can be replaced or substituted. Less harmful can be taken and more harmful substance can be eliminated, and the less harmful, for example, use of lead-free petrol. Lead petrol is causing many diseases, respiratory problems. If we use lead-free petrol, then it's a substitution of the substance which causing harm. So similarly, there people can take or eliminate toxic substances, and they can substitute with less harmful substances. Then comes the legislation. In our first lecture, we have gone through that there is occupational safety agency or organization. Then there is ILO, that is International Labour Organization, and WHO has laid down protocols. So all these needs to be followed, strictly followed by the industry, where these occupational hazards are common and causing the diseases. So legislation should be there. Legislation is there, but the more important thing that it should be implemented properly and followed. So application of proper laws, diseases persons looked after carefully. So those who are disabled or suffering from occupational disorders, they should be properly taken care, and medical facilities should be given to the patient and the family, so that they can be rehabilitated. The worker should enjoy free medical services and leave during the time of treatment. If worker is disabled, he must be given pension or gratuity. So these are the references book, and there are websites. You can go to WHO websites where you can find all these legislation and preventive measures and treatment and what can be done. So if you have any questions, we can take question first, and then we have small videos which will make your concepts more clear. So let me see if there are any questions. Oh, well, the question is that can silicosis be reversed? If it is detected in early stage, then yes. Once the fibrosis is a starter, then it is very difficult and leads to premature death. So, if it is early detected when there are signs and symptoms like cough or breathlessness, then it can be reversed. Once the lungs become infected, fibrosis started, then it is difficult and it is cause premature deaths of the worker. Now I should start video. First is asbestos.
The video is visible to everyone.
Okay.
आवाज नहीं आ रही है शायद।
अब आ रही है?
जी जी मैडम आ गई। नहीं नहीं आवाज नहीं आ रही मैडम।
नहीं मैम, आवाज नहीं आ रही है।
कोई बात नहीं, बगैर आवाज के देख लेंगे, एक्सपोजर पता तो चल रहा है अब। आप देखें वहां से, मेरे पास थे तो ठीक है आवाज। These are the tiny crystals of silica. Macrophage cells has taken these crystals. And these macrophages carry these tiny to the lungs and causing scarring of the lungs. So much scar tissues are formed and affecting lungs. So you have seen the exposures related to silica, coal dust, that is anthracosis, and asbestosis. If you have any questions, please you can write in the chat box, or later you can write me on your through your emails. I have written my emails in the last slide, that is nighat.nisar@duhs.edu.pk. Yes, there was a problem. I don't know why audio is not in these videos, but these videos can be found on YouTube or Google. You can search. There are many more videos which are related to, and there are very good videos which are related to silicosis, asbestosis, anthracosis. This was a just a refresher what we have learned in lecture that you have seen in the videos. The process was same, that the inhalation of the dust particle, and when it is prolonged exposure causing lung damage, progressive massive fibrosis, and lung stops functioning, and there will be a premature deaths due to these hazardous exposures of organic and inorganic dust, which can cause pneumoconiosis. So as there is no question, so there are very good movies related to this anthracosis, like on coal miners. And if you are interested, you can watch. One is old Indian movie Kala Patthar, which is a famous movie, as Amitabh Bachchan has played a lead role in this movie. So there are various stories in terms of life of the coal workers, miners, their families, and the employers, or the you can say the job providers, or the people who are trying to get maximum benefit and providing least preventive or protective measures to the workers, with less paid or underprivileged workers. So there comes the political will or community participation or unions of the workers came into being, and they tried or fought for their rights to have maximum benefit salaries or maximum benefits or protective measures from the employers to perform these high risk jobs. These are the high risk jobs, and people's involved in, especially in coal mining, they put their life into risks, and most of the times these workers are sole bread earners of their families. Similarly, the other occupational disorders in which people put their life into risks, but they are unfortunately less paid, underprivileged, and medical facilities are not provided. And once the worker gets serious morbidity, then the worker is easily fired and the new worker replaced with this diseased worker. So these are the organization and legislations made, as we have seen, that the disabled workers should be rehabilitated, their families should be supported, and there should be a mechanism so that they can back safely into their communities and families and remain productive for lifelong to manage their families. So otherwise, it is very easy to fire a diseased worker and enroll a healthy worker. And this is how the whole family suffer. So now it's not easy. Legislations are there and people can demand their rights. From medical point of view, the important thing is preventive measures which an individual should take. The employer should provide all the facilities, and the individual has got the responsibility that they should go safe while they go to their homes with properly clean and clean clothes so that their families remain protected. And they should demand for their continuous screening and the periodical examination for the high risk occupation time to time so that the diseases can be early detected and proper treatment can be applied. So if there are no questions, then thank you so much. Good luck. Allah Hafiz.